my background, I've worked as a registered nurse mainly in psychiatric settings, inpatient, outpatient, partial hospital, and then when I became the LCSW, I still kind of continue that, mainly mental health work. And now I am in a primary care setting, which I absolutely love that setting for mental health. I think we were talking about it's been like the missing link in primary care for a long, long time. We've had such a separation between physical health and mental health, and they so go, you know, very much go hand in hand. And so what I do at my clinic is I am a provider like the other physicians, PAs, nurse practitioners, and I bill insurance just like they do, but I am there for the purpose of getting referrals from all of my team for people who they think could benefit from behavioral health. So I don't bring my own patients in. It's all by the team that I work with. I see a lot of people for depression, anxiety, two big ones, a lot of grief issues, life change issues, sometimes addiction issues to get people into the right services. Those are probably the main ones, but then any behavioral health change that people want to make, their primary care doctor might refer them to me, like quitting smoking, losing weight, doing better on their diabetic compliance, things like that. So I can work with people behaviorally on those kind of issues as well. So it's kind of a full gamut. I love it because my patient load is entirely different. I might have 16-year-olds who are having trouble in school, and I might have 81-year-olds who have a spouse with Alzheimer's, and they're trying to deal with it. And then everything in between. So it's never dull, never know what my day, I may be all over the place in different issues. From all of you guys, have any of you thought of doing primary care? Is that where any of you want to end up when you get through all this? Okay. You want to be on here? Okay. I just encourage you to keep that thought in your mind as you go forward about the importance of behavioral health in primary care. And if you have that opportunity to work in that setting, it will make your job a lot easier too, to have somebody right there in clinic who can help deal with things and deal with the different crises that occur. Some of the other things that I was asked to talk about are some of the psychological aspects of aging. And I guess you've got the outline for that. But in the next, like 25 years, 20% of our population is going to be older adults. That's pretty significant. They're going to have a lot of needs and a lot of things going on that we need to be able to provide for and deliver. The psychological issues that are so prevalent that you see the most in that population are the dementias, the different ones, which dementia is often accompanied by emotional disturbance, depression, anxiety, and paranoia also. So some mental health needs come out of that dementia diagnosis. Another one is anxiety. About 6% of older adults have anxiety issues. Generally, it's the generalized anxiety disorder group. Anybody have any ideas on why that might be prevalent in that age? having anxiety issues.
Usually going through a big life transition, maybe retirement or something like that.
Exactly. I think sometimes those life changes, you know, you may have never been anxious your whole life, but you may have a lot of changes in that period that induces sort of this state of anxiety that you haven't experienced. I think that's exactly right. And the highest suicide rate of any group of people are older white males. And that's big. I mean, that's what you see a lot of in any kind of setting. And a lot of people, I can't remember the exact statistic it is, but it's something like 60% of people who commit suicide have been to their primary care physician within, you know, the time.
Within a month?
Yeah, a month or something. And so that's real significant. In our setting, we do depression screenings. We do them on all patients who come in. And so we're kind of alerted who may be having issues. We typically do the PHQ-9, and then anybody I see, I do the patient stress questionnaire to get more of an idea about trauma, alcohol, anxiety, and depression, all four of them. Sleep problems, that is huge in that age group. And then another one is the hypochondriasis. That is more prevalent than I have ever realized since I've been in primary care. We have people who have health anxiety issues that become just so disruptive, and some of those individuals are the ones who end up in the ERs over and over and over and over and over again. And, you know, that's a big mental health need that we haven't really addressed before looking at it in primary care. Then substance dependence and alcohol abuse, 2 to 4% of men and 1% of women over the age of 65 experience those issues. And 25% of the prescriptions written in this country are for older adults. That's a lot. That's phenomenal. Then depression, that is big. Sometimes people are depressed and there's a lot of physical symptoms that they are exhibiting or coming in with, and it can be easy to overlook that depression is what's really happening here. And part of that is just some of the normal changes in aging. So sometimes it's hard to distinguish, you know, are there physical things going on? Are these normal aging changes, or do we have depression happening here? And so it will be, you know, important for your skills to be able to distinguish that and consult with other people and, you know, figure that out. Then some of the behavioral disorders happen: physical aggression, wandering, verbal outbursts. Some of that can be from delirium, depression, dementia, and sometimes a psychosis that can occur. So all of those things are the most prominent psychological issues found in older adults. Social issues that occur that are pretty big is, well, one big one is grief and loss, and there's a lot of living loss that occurs. You're still here, but other people have gone on. Or you're still here, but you had to retire from your job. Or you're still here, but you're no longer this big person in the community. that made a difference, that everybody knew, you know, so there's a lot of different kinds of losses that happen. Identity, relationship losses, sometimes lifestyle losses, where we have to diminish, you know, how we live as we get older, and not sometimes have the finances to keep up a certain lifestyle. Independence, huge loss. I think for me, that's probably my biggest fear of aging, is a loss of independence. What are your all's biggest fears of aging? What scares you the most about it?
Loss of memory.
Loss of memory? Yeah.
It's a loss of function, like just going upstairs or carrying things, or.
And that would produce what? I mean, you feel kind of helpless if you can't do what you are used to doing. Yeah. Anything else? What is it?
Abandonment.
Abandonment? Yeah, that's a good one, because a lot of people do end up on their own. You know, many older people, their self is all they have left from their entire lives. That can be devastating to some people. Then with work role losses, imagine you spend your whole life doing a career or being involved in something, and when that is gone because of age and you want to retire, or because of debility, when that is gone, that impact can be phenomenal if you don't have things to replace that. Everybody knows people who've retired and just, that was it. They retired and died, basically. Everybody knows somebody that's happened to. And so oftentimes it's the preparation of getting to that point that's important. So that's something when you're working with older adults, you can be looking at, you know, what do you like to do? What are you doing to enjoy life? And those kinds of things can be added in, a visit for a sore throat or whatever. You can begin to talk to and get people to think about moving forward and what that means. Then common feelings related to losses. Common feelings are things like sorrow, anger, loneliness, confusion, despair. Those are all feelings that sometimes can be real difficult to experience by yourself without having a sounding board. Then also, we have to look at society and the stereotypical images of older adults. That's not real fun to be the older adult and feel real devalued and like you're insignificant and like you don't have enough to offer anymore, or your time's up, those kinds of thoughts. But that's what people feel often, just by virtue of their age and how they're treated. A lot of older people feel like they're treated like they're stuck in the past. You know, maybe they don't know how to turn on a computer, or they look like an anomaly, you know. But those are the things that cause them to feel more alone. Then, as we get older and have physical and functional changes, we can have various limitations that really increase our healthcare costs. And when you have multiple systems having multiple things going on, it can really add up the cost. a lot of people are like, oh, I can't do my CAT scan because I have to get my dentures and it's time for my new glasses, and how will I afford all of that, you know, even with insurance. So those are considerations, you know, as providers to look at. Catastrophic illnesses and accumulation of chronic diseases really impact how significant physical impairment is going to be. How a person responds to and adapts to those physical changes, as well as real contextual factors like their personality. What's their personality always been? Have they been somebody who can't handle stress, and, you know, the first thing that happens, they're like, ah? They're probably going to be that way as an older adult too. If they have a personality where they take things in stride, they try to be positive, well, they're going to probably be like that as an older adult as well. Typically, our personality traits that we have just become more amplified as we age. They don't really change, they just get more amplified. Coping skills. You know, how does this person cope throughout their life? That's going to be significant in how they cope as an older adult. That's going to have a big impact. And the ability to self-manage a disease process, how well they do that, will say a lot about how they adjust. Financial resources, big. If you're a caregiver to somebody, that's a huge burden that may affect how you adjust. And how much support do you really have, you know, from other people? Those are all things that impact how well that person's going to do. One of the big changes is sometimes that change in roles. Parenting a parent is difficult. It's very difficult to become your parent's parent when they end up to the point they might need that. But it's very difficult to be a parent and give up that role, you know, and have your child take care of you. So it's very hard on both people. I see a lot of family discord and a lot of misunderstanding and a lot of just not being sure about what roles are in that situation. A lot in primary care with, you know, parents who they don't want to give that up, and it's very hard. Loss of work role can really lead to that devaluing of self, and sometimes that can lead to feeling like you were saying, feeling real depressed, that your value has changed. And then bereavement is another huge big issue. There's like 800,000 widows each year. That's a lot of people. And, you know, the whole grief process is very different individually. Sometimes there's a lot of anxiety with grief. There's a lot of symptoms of depression with grief, sleep issues, eating problems, crying spells, all of those things. And then we have a DSM diagnosis that if those symptoms after 2 months continue, then it can be considered an adjustment disorder. But grief is very individualized too, and that's another issue I see sometimes in families, is that they're at different places in their grief of losing someone. And so that can create some conflict to just kind of be alert to. Then a loss of spouse means often new duties, new skills that you haven't ever done before or don't know about. And that can be very overwhelming to people. And I think too, the more rigid the sex roles are between the man and the woman, the more difficult that becomes at that time in your life. Because there's a lot that gets, you know, they know but you have no clue, or you know or they have no clue. I don't know, maybe I think younger couples now maybe aren't as rigid in those roles, and it's, you know, a good thing to just know how to take care of yourself, no matter what. Then those are really the biggest changes in social relationships. Then dealing with multiple losses, sometimes you can have just a bereavement overload. You've had too many losses. You're sick, you're losing family, you're losing functioning level. You know, there's just too much going on. And it depends on, when you have losses, it greatly depends on the time between those losses that you had to recover before the next one hit. When you're an older adult, if you have multiple losses and you don't have time between them to recover, that is what causes people to reach just a very catastrophic place, because they never could rebound quick enough before something else hit them. One of the reasons too is that, you know, there are so many people that are lost at that age in life. And I see a lot of older adults who are losing their children, and that's very significant. You know, that's a very tough time in life to be losing your adult child. And I see that. I probably see that as much as I see someone losing a spouse in primary care. Then there's social changes we kind of talked about. It might be though that you're in a new resident, or all of your friends, for whatever reason, you can't see anymore, or you can't drive, you don't have transportation. If you have to move out of your home into some kind of a assisted living or something like that, that it's all new people. There are just many, many, many social changes that can occur. Besides losing lifelong friends that you've had for years and years, that they may pass away or whatever, and then you don't have that support anymore. Economic, big loss of income, loss of transportation. Emotional crisis of multiple losses can result in mental confusion. So that's to be alert for. If somebody's suddenly confused, look at, have they had a lot of losses here? Disorientation and withdrawal. All of those things can happen when you have multiple losses. And there's a sense that everything that was meaningful has been taken away from you. And that loneliness, that helplessness, all of that can lead to sometimes people having suicidal thoughts. It's like, everything's gone, what's left? And some of the characteristics in grief that older adults differ from younger adults on is they identify with the deceased person rather than feel guilt. And they replace their emotional grief reactions with somatic complaints. They often won't talk about their grief or deal with it, or come to you and say, oh, I'm so upset my husband died, but they may be there with multiple migraine headaches, their stomach's always upset, I mean, all these physical things, that's their way of expressing that grief. They also may have a distorted image of the person who passed away. A lot of times they have a very glorified image of that person, that everybody else is going, I don't know who you're talking about, but I didn't who I know, you know. It may be that. And sometimes they want to self-isolate, and sometimes they feel hostile toward everybody. It's like, this got taken away from me, and by golly, I'm not going to have anything to do with the whole lot of you. You know, that kind of attitude. So some of the factors that we kind of touched on, some that influence a person's ability to cope, are two, besides their age and how many losses happen how quick, how they've handled loss in the past. We're our own best teachers, you know. If we get through it once, then we're probably good to go to get through it a second time. Previous ways that we have dealt with everything that occurs at different life stages, that makes a big difference. Whether you have support, use support. You know, I also see probably a lot of estranged older adults with their adult children who, for whatever reason, they're estranged from each other and that support base isn't there. And that's very common. Which you have on the list: positive relationship, person's state of health, belief in a higher power, or belief in something greater than oneself. That's really big with a lot of older adults' recovery and getting through some of the losses they experience. Then, depression in older adults can have like feelings of sadness, loss, anger, frustration. All of those things can be things that interfere with their day-to-day life. Moving to another level of care, or having a chronic pain or a chronic illness that's just always there. Having children move away where you're on your own, having people who are close to you pass away, and a loss of independence. All of those things increase the risk of depression. And then there's quite a few physical illnesses related to depression, like thyroid disorders, Parkinson's, heart disease, cancer, stroke, dementia, and the overuse of alcohol and other medications. All of those physical things are often related to depression. So that's something to consider too when you're assessing. Common symptoms of depression, like fatigue, appetite loss, trouble sleeping. Those three are often part of the aging process, or part of a physical illness that's going on with people, so it can be overlooked that they really are depressed. So that's something to keep in mind. And then keys to coping with aging are dependent on your long-term lifestyle. So everything we're doing now, leading up to that, really affects our outcome in the end. And that's kind of a wake-up call, and I'm sure everybody has their own little thing, and they're thinking, ooh, I should be doing this or that. Your ability to expect and plan for the change has a lot to do with it. The strength you have in relationships with other people is also very, very much an important factor in how you weather getting through older years. And willingness to stay interested and involved with life. You know, thinking about, I know when you're in PA school, you have no other interests, no other hobbies. Life is on hold, I get that. But when you get done with PA school, it's important to go back to what are your interests and hobbies and things that you like that you can value and enjoy throughout your life, and not just be working all the time or just advancing, but you know what's important, and that will serve you well down the road. Talking about what will happen to you as you age and how you will deal with those changes can help adapt to the aging process. So doing that with patients is big. Helping patients cope with the aging process will help their sense of well-being, and some interventions include helping them accept reality, for one thing. If they need hearing aids, get them. If they need glasses, get them. I mean, we need to encourage people. You do need this. Please get this, because this is keeping you connected. If you can hear the people around you, that's connection. That kind of thing. Keeping a positive attitude and continuing to set goals and work toward those goals. We never get too old to achieve goals. See your primary care physician regularly. Make all your medications known to all the doctors that you see. And getting regular exercise. Change eating habits with a diet that is balanced with less fatty foods, and keeping active socially to prevent isolation. So those are all interventions to use to keep a good psychological outcome through that aging process. Do any of you think it's just depressing to think about? You don't even want to think about it. Yeah. Do any of you particularly like working with older adults? Is that your niche for anybody? Several of you. What is it you most enjoy about it with older adults?
Just their life experience, just learning about that. That was always a lot of fun.
That is fun. And it's almost like sometimes you feel like you're really getting more from them than you're giving, you know, when you get to interact like that. Because they can have great stories. Any other thing?
Yeah, like when you really help them, they're super gracious.
Absolutely.
Very appreciative.
That's one of my favorite things. You always get a thank you, always, or I really appreciate what you've said or done or whatever. And there are certainly groups of individuals that never occurs to. So that's a big one. Anybody else? through their own voice. Okay, so it's kind of like a feeling that you can empower them, a feeling of giving them some of their independence back by being an advocate. Okay, those are some good thoughts. So this leads me into, now is the time, I'm not sitting and talking anymore. We're gonna interact and move, and I know OCU has a great drama theater department, and in fact my daughter went to it. So, I don't know if any of you have the secret desire to be in theater, but somehow you ended up in PA school. But what we're going to do is some interactive, experiential scenarios.